Hello students, let's now quickly glance through lithium in 1 minute. Lithium, as all you know, it's a mood stabilizer, okay, and the mechanism of action, it has varied mechanisms starting from affecting the sodium potassium ATPase, stabilizing the membrane, and also stabilizing the brain derived neurotropic factor, which is one of the most common etiological factor implicated in mood disorders, also in gene regulation. And the therapeutic drug monitoring, because lithium has a narrow therapeutic index and we should do after 5 days of initiating treatment to lithium. Why? Because the half-life of lithium is around 1 day, and as you all know, the steady state concentration of a drug happens only after 5 T-half. So here we will do after 5 days, and the indications of lithium is bipolar affective disorder, suicidality, cluster migraine, and an augmentive or add-on therapy in depressive disorders. What are the side effects of lithium? Like neurological tremors, and can cause hypothyroidism, can affect in the kidney because the main route of excretion is through kidney, can cause diabetes insipidus, GI like nausea and vomiting, skin like rashes, and cardiologically can cause sinus bradycardia and benign T-wave changes. And the risk factors for lithium toxicity is dehydration and hyponatremia. And this therapeutic drug monitoring, because I told this, having a narrow therapeutic drug index, most of the times the index varies between 0.6 to 1.8 milliequivalent per deciliter. And very importantly, you should remember more than 1.5 the toxicity starts, and the treatment we can classify into more than 2 we should start stopping lithium correct dehydration. But once the levels go more than 3, we should go to dialysis, and more than 4 there is high chance that patient can go for death. And as you all know, lithium can cause teratogenic effect in the first trimester of the pregnancy. It can cause Epstein's anomaly, like having the right side of the mitral valve defects, right? And one important thing you should remember is that to summarize these things, I have a good mnemonic: lithiums. So L stands for the levels which I have already told, and I stands for increased urine, which means diabetes insipidus, and T stands for tremors, and I the drug interactions that will be happening with lithium, and the U stands for upset of stomach, and M stands for muscle weakness, and S stands for skin reactions. I think that itself is very good, right? We can remember lithium with the mnemonic of lithiums.